So I have kind of like my I don't know how to describe this. The way that my teeth align or sit together, my upper jaw, the internal ridge of those teeth sits inside the pocket of my lower teeth. So what I'm trying to say is that um, my lower jaw is narrower than my upper jaw. Does that
Yeah,
make sense?
yeah,
Is that normal?
can you show me what you mean?
Uh-huh.
Okay.
So I don't know
Uh
how to
just
visual.
just bite and smile wide. Stand back a little bit and just peel your lips back, please. Yeah, peel your lips back right there. Um, it seems pretty. It seems. Uh, yeah, you have a pretty decent bite. You know.
Mhm.
I would say both jaws are narrow, and I would say so. What it looks like to me is your lower teeth are tipped in pretty aggressively, which is
Yeah.
super standard for underdeveloped jaws.
Okay.
The lower teeth just tip in to match the narrow upper jaw.
Yeah.
So I would actually say the opposite. I would say your lower jaw is wider than your upper jaw,
Oh, really?
but the
Okay.
lower teeth are tipped in, making it seem like your lower jaw is super
Okay.
narrow. But were you leading this to like questions about mandibular skeletal expansion?
Right. Well, that's actually, yeah, I was wondering about double jaw surgery. Are they able to adjust for that, or does the adjustment of the lower teeth have to happen during the orthodontics after an MSC?
It mostly happens during the orthodontics after the MSE. That's the
Got it.
best time to do it. And what would happen is those teeth get uprighted with the
Perfect.
orthodontics, which buys you several millimeters down there.
That's
But
all I want. Yeah.
here's what happens during surgery. During surgery, your lower jaw, well, this doesn't actually affect occlusion too much, but it does affect the appearance of the wideness of your lower jaw. When you advance the lower jaw during surgery, you take the fatter part of your mandible, which is right now buried in your neck,
Hmm.
right? And you advance it so your lower jaw gets the appearance of being wider. But in terms of the width of the lower jaw, when the width of the occlusal plane of your lower jaw, like the biting surface of your
Hmm.
lower jaw, that
Yeah.
has to be fixed during the orthodontics.
I
And
see.
that's one reason why doing maxillary transverse expansion non-surgically with MSE is a better approach than doing a three-piece segmental surgery, because when you do a three-piece segmental, in other words, when you do what MSE does, but you do it under the knife at the same time that you do the surgical interiorizing of the jaw,
Hmm.
the advancement of the upper jaw,
Yeah.
then you're basically fucked on the lower jaw, because what you can only transverse expand the upper jaw surgically to the width of the lower teeth.
Hmm.
So it becomes a limiting factor. So if you can widen the lower teeth orthodontically, then during surgery, you don't face that limit of how much you can how much you can widen the upper jaw. So
Okay. Got it.
widening is best done surgically, or even I
Hmm.
would say widen the lower jaw orthodontically, and then you can widen the upper jaw more surgically. But the best way to do it is to just widen the upper and the lower jaw non-surgically with the skeletal expander, and then dental tipping of the lower teeth, and then just do advancement surgically.
Okay. That's really helpful. I'm glad that it won't take a whole lot of extra procedures. And I mean, in the ideal world, for my lower jaw to kind of catch up to my upper jaw with that expansion.
Yeah, man. And just on that note, like I've interviewed several very, very high level orthodontists this year on
Hmm.
my channel. Most recently, Mariana Evans yesterday.
Oh, really? Okay.
She's like a super heavyweight in space. And I was like, I asked Dr. Ting, what do you think about mandibular skeletal expansion? He was like, nah, fuck that. I asked Dr. Lipkin, same thing, not necessary. Um, and then I asked Mariana Evans, do you think MSDO is important? Like, do you think we should be able to do distraction osteogenesis on the lower jaw? She said it's not necessary.
Mm.
So the consensus is that lower jaw widening
Mm.
with a distractor, like an MSE for the lower, it's not going to happen anytime soon. Dr. Yousefian is the only one who does it. So it's just not really an option, bro. And if it's not an option, then why even worry about it?
Yeah. Yeah. And I mean, like, it makes some sense that if the majority of the changes were happening for me, initially in the upper palate that the dental tipping on the lower half can then be reversed kind of similarly with orthodontics, and it would be better not to have to do surgery. So I'm really happy that there's some sort of consensus between all the best providers minus the one. So
Right, absolutely.